Hi and welcome to Heal My Hemorrhoids. In this video you will learn what the symptoms of internal hemorrhoids are, so watch the whole video to the end to get all of the tips you need to cure the hemorrhoids or prevent from getting them. Remember to hit the subscribe for more videos like this and press the like button if you like this video. The first symptom of internal hemorrhoids is bleeding. Either you see the blood that is bright red in the stool or on toilet paper. The other symptom is if the hemorrhoid prolapse and comes out. Internal hemorrhoids are often painless, but they can still cause a lot of problems even if you can't feel them. Also known as inner hemorrhoids or internal piles, these conditions cause inflamed vascular structures inside the anal canal. They're located above the pectinate line and mostly painless. Unlike external hemorrhoids, these can't be seen from the outside since external hemorrhoids are located below the pectinate line. Internal hemorrhoids are covered with intestine cells and they can be harder to diagnose. External hemorrhoids, on the other hand, can be easily diagnosed since they're not concealed inside the rectum, unlike the internal ones. There are some ways you can use to notice internal hemorrhoids, and there sure are different options to treat them as well. What causes internal hemorrhoids? Having hemorrhoids is a normal thing for everyone since we all have them. We only notice them once they pose a problem to our health, and internal hemorrhoids are no different in these cases. When we mention hemorrhoids, we mean the inflamed version of them that causes a lot of problems, and that's not all. Internal hemorrhoids, however, are caused by inflammation of the end part of our large intestine. That part of our intestine is used to store our bowel movements. The veins inside that part become swollen by muscle and other connective tissues that cause internal hemorrhoids. They form pretty much near the end of our rectum and they're mostly painless even if they swell. The only way you can feel them once they relapse and cause some unusual symptoms to show. If you feel like having pain, then it has to be because of something else, not internal hemorrhoids. Stages or grades of internal hemorrhoids. There are different stages of hemorrhoids and not all of them form because of the same reasons. These stages are measured by intensity and their severity. Stage 1. In this stage, the internal hemorrhoid is prolapsed and causes a bleeding session. But they still stays inside the rectum and is not spread out further. Stage 2. After prolapsing, the internal hemorrhoids tend to extend out the anal canal and they can even reduce on their own. Stage 3. At this stage, the hemorrhoids don't reduce and it's even further prolapsed than the previous stage. Although they can manually reduce themselves, which is good news. Using different methods, these hemorrhoids can be pushed back into the rectum. How to push a hemorrhoid back? And watch the video or read the blog at healmyhemorrhoids.com. Stage 4. The internal hemorrhoids at this stage are the most intense and severe for the patient. At this stage, the internal hemorrhoids cannot be reduced and they remain like that. Even if you try manual reduction methods, they won't exactly work on this. Symptoms of internal hemorrhoids. The symptoms depend on the severity of the internal hemorrhoids and they vary from time to time. That's one of the most confusing problems you may face, because even if you have a severe case of internal hemorrhoids, you are not likely to feel any pain. That's because of the lack of nerve endings in your lower intestine. Although if you feel pain, then the reason may be because of external hemorrhoids or cases of anal fissure. In most cases, you'll notice painless bleeding sessions. You can either see the blood with your stool or with your toilet paper, and that's how you can start suspecting this issue. These bleeding sessions usually happen during bowel movements and a lot of times they go back to normal on their own. Bleeding, although you can't be that sure just by looking at blood in your stool, because the same symptom can be seen in patients with colorectal cancer. And that is why seeing a physician and getting diagnosed once you've seen the symptom is very much recommended. And take it more seriously even if it doesn't involve other suspicious symptoms, because rectal bleeding is never a normal thing to experience. Tissue prolapse. We already know that there are two cases of hemorrhoids where they form either inside or outside the anus. The internal hemorrhoids can prolapse, and that is when the swellings manifest outside of the anus. With the swelling, it gets hard to control the bowel movement and you may experience those tissues to be on your stool. Most of the time, they stop prolapsing and go away automatically unless you're having grade 4 internal hemorrhoids. Other forms of tissue prolapses may occur in the form of mucus discharges, irritation, and visual traces of the tissue prolapse. However, for internal hemorrhoids, the pain is mostly not a part of the symptoms, which is not the case with external hemorrhoids. Causes of internal hemorrhoids: constipation or diarrhea or both. Having either of these conditions puts a lot of pressure on your intestines. Straining the rectum or too many bowel movements in small time can cause stress on your rectal area. It can even cause irritable bowel syndrome and furthermore, end up with hemorrhoids if not treated quickly. Improper diet: if your diet includes foods high in fat and low fiber, it will cause a lot of stomach-related problems and they can cause severe irregularities in your bowel movement. Having an improper diet can be the sole reason for internal hemorrhoids formation, and that's why a proper diet is a necessary thing to have in your daily life. Pregnancy: a lot of women suffer from internal hemorrhoids during pregnancy since a growing fetus puts a lot of pressure on the pelvis. And that leads to straining your lower intestine and causes internal hemorrhoids. Obesity: people with obesity have a higher risk of getting hemorrhoids since obesity is associated with poor lifestyle choices and improper diets. It can cause both internal and external hemorrhoids, and that's why people with obesity are at a higher risk. Lack of exercise: if your daily activities include too much sitting in one place and not many exercises, you may have a risk of developing internal and external hemorrhoids. That's why having yourself included in a regular exercise schedule can be useful in preventing hemorrhoids. How are internal hemorrhoids treated? In terms of treating internal hemorrhoids, most of the time it is believed that this condition ends by itself. Because most of the time, internal hemorrhoids don't show any major symptoms and can reduce the hemorrhoids automatically. But there are some known ways on how to get rid of internal hemorrhoids in case the disease show more than one symptom. They range from non-operative medical interventions to office-based surgery procedures. However, that will depend on factors such as age and severity of the condition. Since the low severity of internal hemorrhoids can be helped by some lifestyle changes and aggressive treatment isn't necessary. Conservative treatments. This method of treatment for internal hemorrhoids focuses on diet and lifestyle. It is the basic and the key to preventive as well as curative measures to the disease. The patient is required to take lots of water, avoid stress, reduce fat consumption, and exercise regularly. Consuming fiber-rich foods also helps the patient avoid constipation by reducing shearing action, which is one of the major causes of hemorrhoids. Non-surgical treatments. They are processes used to treat the disease but are mostly done in offices. They include methods like band ligation. This method of treating internal hemorrhoids is pretty simple but decent on the outcome. It deals with the less severe stages of internal hemorrhoids such as stage 1 and 2. The procedure involves inserting a rubber band around the base of the hemorrhoid to cut off the blood supply to the tissue, making it shrink. Sclerotherapy. This procedure involves the injection of the hemorrhoid vein with a liquid containing drugs such as polidocanol, quinine, or zinc chloride chemical solution to harden it. It is used to treat internal hemorrhoids that are too small for rubber band ligation. Coagulation. In this type of treatment, the infrared light wave is directly applied to the hemorrhoidal tissues through the applicator's tip. This method treats grades I and II of the disease. Surgery. In case a patient has stage 4 of the disease, surgery is recommended. It is also crucial in treating grade 3 patients and those with thrombosed hemorrhoids. More on hemorrhoid grading here. Final words for internal hemorrhoids. It's always hard to notice someone with hemorrhoids because the symptoms can only be experienced by the patient themselves. And a lot of patients doesn't even bother to inform their doctors about these conditions because they think to find the condition embarrassing. And finding symptoms of internal hemorrhoids is even harder than external ones because their symptoms don't include pain, unlike external hemorrhoids. But if you're able to identify the disease in its early stages, it's very easy to treat it. The treatment doesn't even require aggressive methods and you can easily unburden this condition. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com or this YouTube channel.